Gauteng clinics and hospitals have been making headlines for all the wrong reasons recently. Corruption, mismanagement, staff shortages and obscenely long patient queues. One such hospital is in Tembisa. Patients say the delays for services are simply too much.
I always see the hawks come in and out, and they are here the whole day. It makes me feel bad for our hospital here in Tembisa.
This hospital is fun.
Tembisa Hospital is not the same as it used to be. There's so much corruption. The nurses are given all the extra jobs, which is wrong. They should be hiring people like us who are unemployed.
The staff, they are okay, but the way, they are providing their services, I think they are a bit slow.
This woman was turned back by staff at Tembisa Hospital. Nurses say they couldn't help her as the hospital pharmacy was closed. She has a severely infected foot and had to be carried back home by her frustrated family.
They didn't even attend to us, and it made us feel bad because she's suffering from severe pains.
Tembisa Hospital is one of those that have been beset with a barrage of negativity ranging from corruption, maladministration to simply having too many patients with too little staff. Provincial Health MEC has acknowledged the problems in the hospitals.
If you go to clinics, you go to hospitals, our hospitals are packed. People are on queues, they wake up in the morning. But if we are coming directly to where they are, Ematelakufa Hostel, where they can get all those checks that they can get in the clinic, that will be better for us.
The problem of failed accountability at Tembisa Hospital runs pretty deep and can really, on the one hand, only be addressed systematically through a change in the governance and accountability structures within the Gauteng Department of Health. In the short term, there needs to be a very close scrutiny placed on the provincial government.
Nursing union Denosa says that more than 5,000 nurses are sitting at home jobless. Many are so desperate for a job, they're looking overseas for work.
There is a shortage of nurses in particular of about 27,000 in our healthcare facilities across the country. And the long queues that you see in our healthcare facilities, in clinics, in community healthcare centers and in hospitals is indicative of the dire need of healthcare professionals.
Load shedding and the lack of water has added to the strain, but in the end it's the patients left on the receiving end of all that's wrong with the system.
The state of our public healthcare system is dire. Public healthcare system in South Africa is falling apart. It is neglected. Those in positions of authority, political heads in particular, don't care.
Most staff have been left demotivated.
As a healthcare professional in particular, a nurse to be specific, or a doctor, it's demotivating to even wake up and go and work there.
And those who want to expose corruption are in fear of their lives. Whistleblower Babita Deokaran was allegedly murdered for exposing a 1 billion rand of irregular tenders and fraudulent activities at the Tembisa Hospital.
Some kind of private arrangement needs to be established for whistleblowers to receive some kind of protective service if they are under threat, and it's validated. But it's a very, very difficult problem to solve, and it appears as though government is reluctant and has no political will to address the whistleblower protection issue because it actually places many senior people at risk.
But it's not all bad news. Some patients had a more positive outlook.
For me, this hospital is good and it saved me and my leg. I can see they are improving the hospital, so it's a good thing.
For SABC TV News, I'm Nozintombi Mia.